Drug that's making all the headlines, Herceptin. 3 recent studies of the drug have demonstrated dramatic findings in treating breast cancer. Joining me now to talk about those studies is hematologist and oncologist Dr. Johnetta Blakely. Dr. Blakely, thanks so much for joining us.
Thank you.
Tell us what the results of those studies have shown about the effects of Herceptin on early-stage breast cancer.
Well, Herceptin has been used for many years in the metastatic setting, and recently those studies used Herceptin in the adjuvant setting, and that means that when patients have breast cancers that have been removed or prior to being removed, they used Herceptin during their treatment along with their chemotherapy.
Tell me how Herceptin works.
It's a monoclonal antibody, and the antibody binds to a receptor, which is called the HER2/neu receptor. And that antibody binds, and then the immune system takes over from there and clears the cell. And in those studies, what happened was that the women who had Herceptin who did better than women who did not have Herceptin and were also positive for the HER2/neu receptor.
Now, does this mean that Herceptin could mean that you don't have to have chemotherapy anymore?
I don't think so. I think that chemotherapy and radiation will always be part of our armamentarium to treat breast cancer, but I think we're still learning where Herceptin fits in the treatment.
Well, tell me how the findings do affect women who have early-stage breast cancer.
The HER2/neu is overexpressed in women who have breast cancer in about 10% to 15% of cases. In those women, Herceptin should be used during their treatment. Those studies do show that there is improvement of survival.
Dr. Blakely, thanks so much for joining us.
Thank you.